Hello and welcome. You're joining us live. I am Shweta Kothari. With me is my colleague Bharat, and today we're bringing you a story which is heartbreaking, coming in from Bihar at this point in time. As many as 100 kids, ladies and gentlemen, have died over the course of last few weeks as a result of acute encephalitis syndrome. Now, doctors are not sure. Doctors are, of course, calling it a case of hypoglycemia. However, various reports coming in that multiple children are dying with each passing minute due to encephalitis syndrome. Bharat, what's the latest we're getting?
Considering that this right now everyone is outraged about the disease, but the news have been pouring for last 10 days. The deaths, though national media did not cover it, it was in print, and it got into people's attention just after yesterday coverage of by TV9 Bharatvarsh, Ajit Anjum, regular coverage. After that, the coverage, the administration woke up, including the health ministry, woke up after 10 days of these deaths. Only on Sunday there were more than 20 deaths of kids, and all in Bihar this disease is called chamki bukhar. That means brain fever. And most of these kids who have died, their parents are poor, and the reason the outrage is not, even now, even social media is not debating on this topic, is because it has not got that much media attention. Once the coverage starts, then we hope that more attention would be given. At the same time, after Harshvardhan visit to the hospital where the kids are being treated, the condition of the hospital is very bad. Consider that there are not enough doctors. Even the MP from the area, Muzaffarpur area, who is a BJP MP, Jay Nisad, he is saying that if the number of doctors were sufficient, the deaths toll would have been 0. So if the problem is that number of doctors are less, they cannot blame anyone, because the government, Nitish government, has been in power there for 15 years. So it shows the total
it's a total failure of the healthcare in the state of Bihar, ladies and gentlemen, a total failure of the healthcare system, a failure of the Nitish Kumar government. Remember, a meeting was conducted of all the senior officials of the health ministry today, in which preemptive measures and measures going forward were discussed. But has the government been sleeping? Over 100 deaths over the course of last 2 weeks, if I'm certain.
Yes.
Over the course of last 2 to 3 weeks, there have been 100 kids who've died. Now, what causes Japanese encephalitis or encephalitis per se? Remember, it's caused by the contamination of water. It's spread through water. We're given to understand it's a neurological disease. However, let's come to the main important point here, which many media channels, many media houses are missing at this point, Bharat, and that is that the doctors are denying that this is not a case of encephalitis, rather it's a case of hypoglycemia. Where is the anomaly? Why is there a confusion?
So doctors are not saying that all the deaths are due to only one disease. There are 2 or 3 causes they are saying, and even government has not been able to confirm what is leading to death. That is more horrific, because till right now 250 other kids are being treated. If they are not able to identify, they won't be able to treat them. So hypoglycemia is a shortage of glucose in blood, and second thing is that till now the treatment has not come from the government side. All the kids have died. Whoever have gone, means a considerable amount of time have been in fever. One thing, and second thing is to be noted that the apathy of the government. The government of Bihar government and both the central government woke up after 10 days of these deaths. And yesterday, and when the meetings were happening, Ashwini Chobe, who is Minister of State Healthcare, who works under Harshvardhan, Dr. Harshvardhan, he was sleeping in the press conference. Second, the health minister, Mangal Pandey, he during the conference asked the other person that what is the score of India-Pakistan match. So that also highlights that...
What apathy from the senior official, what absolute apathy from the state government. Who's to be blamed apart from the state government in this case? I mean, the entire onus, the fact is that when so many deaths happened, let's go back to 2017, when so many deaths happened in UP, the UP government took action and ensured that the number of deaths that were reported in 2018, remember in 2017 as many as over 557 children were dead due to encephalitis. When you talk about 2018, which is last year, that death toll reduced to 187. So they woke up. But they only woke up after so many children died. I think the same is happening in case of Bihar. When the kids started dying early in February and March, there were no actions, there were no preemptive measures that were put into place, and as a result of which the death toll right now is at 100.
According to Down to Earth, there were only 8 deaths in 2018, and this time the deaths are around 100. And many are arguing that the deaths have been happening since 1995 in Bihar, Muzaffarpur, Bihar. But the argument should be that if deaths were happening for so long, so what action was taken to see that these deaths don't happen every year? Because this is something that is regional and it happens every year. So action should have been taken and there should have been preemptive measures. Right now, when Dr. Harshvardhan visited the place, he said that a research team will be formed to identify the cause of the death and to sort it out. But he also saw the condition of the hospital. There are not enough doctors there are not enough medicine, the kids are being treated on floor, the women with their daughters and sons are lying on floor, and this kind of condition is there. Even the doctors are saying that they don't enough have manpower to treat these kids. So after seeing that Harshvardhan did not took note of this problem, then he said that they will do something by June 2020. So that will happen till now. That is what government
So essentially the government is saying that till June 2020 our hands are tied, there's absolutely nothing we can do, and hence the situation will continue to be the way it is. Kids dying, just 20 kids died yesterday, as many as 100 kids have died over the course of last 3 weeks. The situation, ladies and gentlemen, of the healthcare in Bihar is in tatters. The Nitish Kumar government perhaps a little too late to finally wake up. Let's quickly get in a few comments, before we move forward. Bharat, comment of course coming in from Ajay saying necessary action should be taken ASAP. Those are babies, of course. And just to bring this to our notice once again, it is important to point out that this is not the first time that Japanese encephalitis or encephalitis has hit India. Remember, it came in India back in 1955. It's been 4 decades and nearly 10,000 children have died due to encephalitis. Hence, the disease is not new. It is preventable. It's curable. And what's more important at this point, Bharat, is to make sure that the government not only caters to the rising cases, the cases which are currently admitted, but also makes room for any further case which may arise, because the number is only going to go up as humidity increases and the temperature changes. The temperature, changes with monsoon arriving and the monsoon season, which is conducive to encephalitis virus. This is only going to get worse.
Definitely that this problem is going to get worse, and it is a sign. The deaths have been happening for a really long time, and the government cannot claim right now that they can't do anything. They have been in power. Nitish government has been in power for last 15 years. In 15 years, if he was not able to make the healthcare system better, then definitely he need to step down, or someone should take power and do the right thing. Because the health minister is sleeping or is more worried about the India-Pakistan match, and that is the apathy of ours. So even India, instead of discussing the deaths that are happening due to climate crisis and due to these diseases, the kids dying, we were all busy discussing India-Pakistan match, which is also an entertaining thing. But at the same time, we should focus on real issues.
And this, of course, is a real issue, ladies and gentlemen. We will keep tracking this issue to be particular very, very closely. Let's quickly get in another comment that is coming in at this point from Sushanta Saha. The IMA should intervene and send a team of experts. Enough of the politics in West Bengal. Pooja Khanna writing to us, very sad and shameful to the high authorities. Of course, a lot of angry reactions coming in, a lot of people condoling the death. Remember, the Nitish Kumar government has also condoled the death, but condoling is not enough, is it? I mean, there have to be concrete measures that need to be put into place. What can be done? Let's take a cue from what the UP government did back in 2017 after 557 cases of encephalitis were reported. What has essentially happened, that an action plan was put into place by the UP government, by the Yogi Adityanath government. There was a vaccine drive that was carried on. There was an information drive that was carried on, told to people, the poorest of poor people, to whom healthcare may not be accessible, primary as well as secondary. They were told to make sure that preemptive measures are put into place. They are told to make sure that the kids don't sleep in mud. They were told that kids should not be drinking water that is not coming from a safe source. So that sort of information drive, of course, was put into place. An immediate response team was also put into place by the Yogi Adityanath government. Health and sanitation drive was carried out, as a result of which the death toll, which was as bad as 557 in 2017, was reduced to about 190 in 2018, to about 2/3 of what it was in 2017. So perhaps the Nitish Kumar government must take a cue from their counterpart in UP, Bharat.
Yeah, definitely. Any government, not just Bihar, any government needs to create awareness on such issue. Because if the deaths are happening for a really long time, so you have time to understand what causing the death, where the government is lacking, where the citizens are not proactively taking the right steps to counter such diseases. So all these steps could have been done, and the wake-up call, this one is too late to be called a wake-up call, but at the same time we have to see that Nitish government is not forgetting. I think they were waiting that for 10 days, as there was no response from the state government and the central government. Actually, they were waiting that with the season that people will forget about the disease and they will go back to their work. Now the outrage is there, so even citizens need to question the government, no matter which party they support, no matter what they believe about these diseases. They should come out and should question the government and should hold them accountable. Because as I believe that 10 days, there was not a single statement from the health minister of Bihar, who is Mangal Pandey. He did not even give a statement on the disease. Yesterday only, after the outrage, when Dr. Harshvardhan reached to the state and did an inspection, then only they came out publicly on the disease. Even Nitish Kumar was not there till yesterday.
All right. So, many people, of course, are asking at what measures can be put into place to ensure that children do not, they do not contract Japanese encephalitis. So, one of the main reasons of Japanese encephalitis, ladies and gentlemen, is mosquito bite. So, how to prevent it? Apply repellent, wear full sleeves clothes, make sure that your children stay away from mosquito infection, and the fact that they stay away from where they are accessible to a lot of insects and mosquitoes, to be particular. So these, of course, are the measures that can be taken at this point in time. We, of course, will continue to, as I mentioned, bring the story out to you very, very closely. Let's quickly take in a few more comments that are coming in. Dr. Ashirvad writing to us, Japanese encephalitis is spread by mosquito bite and pig is an amplifier host. Kindly enlighten regarding the mosquito control measure, which is such an epidemic in the concerned state. So, of course, Dr. Ashirvad, they're clarifying for us that Japanese encephalitis is caused due to mosquito bite, and therefore you should ensure that your children are protected from mosquito bite. Shehbaz writing to us, doctors protesting also impact innocent patients. Many innocent death by this protest. Right. So if he's, of course, talking about the protest in West Bengal, which has just been called out by the doctors in West Bengal, we're not getting into that. Shehbaz, what we are essentially talking about is the unfortunate death of 100 kids due to encephalitis, allegedly. Not sure. Many doctors are saying that encephalitis may not be the cause. Gulam writing to us, 100 plus kids dead and the silence is deafening. This shows the kind of government that the voters elected and chose for themselves. They are being paid for their choice. As simple as that. A very, very, glaring statement there. A very important statement there, of course, coming in from Gulam at this point.
I would like to point out that it is very insensitive statement. At the same time, even opposition is sleeping. The Tejasvi Yadav, who is in opposition, he has not talked about the issue for the last 10 days. He is in opposition. Opposition is supposed to held accountable. They just don't need to. They are not just there to fight elections. They are also to see that the government is working properly. Here, Tejasvi Yadav has been missing from the scene for the last 10 days. The opposition is completely sleeping. If they would have wanted that this kind of situation does not arise, they should have questioned the government. They are completely sleeping. Even those people who came, who fought election there and got media limelight, they are also missing from the space. They are not discussing on the topic. That's the deaths that are happening. So those people who would have brought the issue to the public, they are actually sleeping, including the opposition. So we cannot only blame the government. It seems that the overall machinery of opposition and the ruling party are in cahoots to keep silent on such issues. which actually impacts the poor and which actually impacts the citizens. It seems like that because 10 days no one is talking about the issue is a big thing. Somewhere
maybe it's not political enough, Bharat. Maybe that's the reason why. Maybe it doesn't ruffle enough feathers. 100 kids dying maybe doesn't affect the media that much, but that doesn't mean there will be no attention to it. It is a cause that we continue to take up here. Let's quickly listen in to a few more comments that are coming in. RC Natarajan writing to us, most important step is to keep area cleaned of mosquitoes, especially in slums and dwellings of poor class of people. Encephalitis is caused by a virus that spreads through mosquito bite. So, of course, mosquito bite, remember, ladies and gentlemen, is the cause of encephalitis. The host can be a pig, but the carrier is mosquito. Therefore, you must ensure that your kids are not in the reach of insects or the mosquitoes. Ensure that you use repellents. Make sure that your kids wear full sleeves clothes. Take all the preventive measures that you can, but it's not the educated people who don't do it or who don't protect their children, Bharat. It's the poorest of the poor. What do you do for them?
And the affordability is a case. That is what need to be focused, is that we just not focus on the disease at the hand. At the same time, the healthcare system in Bihar, that is in shambles. Consider this, the hospital where Dr. Harshvardhan visited, the ICU was in pathetic condition, and kids are outnumbering the number of beds there. So, and it is in Muzaffarpur district, which has a considerable number of people, or means population is too high. Even then, the number of hospitals or the hospital beds are very less. So consider this, that even the healthcare is not really great there. So we need to focus on the healthcare.
And multiple deaths happened when Union Health Minister Harshvardhan was, of course, visiting that hospital. Those are, of course, the reports that are coming in, that multiple deaths occurred in his presence when he was visiting that hospital. And one of the child who died, the girl's parents also confronted, the Union Health Minister. This, of course, is a terrible situation, ladies and gentlemen. The situation in Bihar at this point in time. We will, of course, keep tracking all the details here very, very closely. Thanks very much for watching. Remember, it's a terrible situation in Bihar, and if the Nitish Kumar government or any authority of the Nitish Kumar government is listening, pay heed to the people who voted you, because they voted you in power and they can vote you out too. Thanks very much for watching. Stay logical.
Thank you.